Good morning and welcome to a new week right here on Jasiri. It's fantastic being back here on a Monday. I know I'm looking as bright as the sun because we need to bring the sunshine, the joy, all of it together for you right here on the show. I'm Tolulokwe Adeleru Balogun.
Welcome. Nigeria is, let's say, a comedy most of the time, and we are always here to dish you all the stories, everyone you miss, and the ones you didn't even catch at all. Welcome to Jasiri on this beautiful Monday. Yes, I'm looking black and white.
I was going to say,
my name is Modupe Elebute-Odunsi. David, you're welcome.
I was going to say, Lola, what's happening? Why is your skin skinning? Why are your clothes
everything is just given. Maybe because
everything.
I've been singing to myself, Valentine is coming. Where is your boyfriend? We're not singing it to you, Tolu. You don't deserve that song.
Please, let's save the banter for later. Listen, so many things have happened over the weekend. Nigeria is hot. Believe it when we say it is hot. But in the midst of everything that's happened, we can confidently say that we are happy, we're relieved that finally the Ekiti school students who were abducted last week have regained their freedom. Unfortunately, the driver didn't make it and he was killed before they were rescued. So that at least that is one positive that has come through. Maybe can we say that prayer now works?
I don't. Please don't go to that prayer on the Monday. Please.
Prayer is the key. Prayer is the master key.
And this choir, this girl group can definitely not work, ladies.
Oh, good. So really make a good girl group coordinator.
But no, we are very happy to see and to hear that the children have been, of course, hopefully reunited with their families. Now, we know that they were with the police and the state governments, but there's just been a lot of conflicting stories in the meantime as to who rescued them. Was it the state government? Was it Amotekun? Was it the police? So many people. And then, of course, just the fact at the end of the day that it's gotten to this point where it has spread. We're expecting to hear another one. Then, of course, there was another one this weekend. Another traditional ruler was killed and his wife was abducted. So it just doesn't seem to stop.
And another thing we know that those people that are rescued, it's one thing to be rescued from such a harrowing experience, but they need to be cared for. They need therapy. You know, in Nigeria, we're not big on therapy.
No.
There is no way they would not have PTSD.
Yeah.
They would have been traumatized. You know, they might not have eaten. You know,
we just assume, you know, for us, we just say, oh, you know, thank God they're safe and sound.
Yes.
And we move on to the
business
next
as
thing.
usual.
Yes, we move on to the and then we say, oh, they're children, they will get better.
No.
They are young, they will heal. There's so many dynamics to this that we take for granted. We just assume that, as Lola said, it's a harrowing experience. Some of them have not, and you know, okay, it's okay.
It's okay. But the thing is, let's be honest, it's actually not okay. Because there are even questions around whether or not ransom was paid, because there are reports that the family said they paid ransom. There are also reports around whether or not abductors were actually apprehended. Were they found? Were they rescued?
We are just happy that they're back, and then nobody wants to ask the deep questions.
No,
it's a necessary question.
Yeah, it is.
The necessary question we need to ask, because it's something like a common occurrence. So we need to know what went down so that subsequently we would know what to believe. We are in the media. This is where everybody wants to hear the news.
Yeah.
Everybody will tune into News Central because they know that, oh, you're going to get authentic stories. But when we ourselves are finding it very hard, you know, grappling with, you know, pockets of, you know, information. I heard that it was a gallant effort of the Amotekuns that actually rescued them. Some would say it's the police, you know. Just look at the children. They're looking so unkempt.
They're looking so tired, so exhausted. Look at them. I mean,
no.
You know, where were they put? Their legs, they look so... You know how when you have not reached home for how many days, and you just... I cannot begin to imagine what has been going on in their heads. But as we say, Nigeria is hot. The citizens aren't smiling. One ex-user posted, you know, his displeasure.
Yes, that one was really vocal about what he said. You know, he said Nigeria is hot and the citizens are not smiling. Honestly, it's a general thing. But one ex-user actually posted his displeasure about the Nigerian police, you know. He queried them for giving excuses after the abductions have taken place.
Oh, I mean...
In his tweet, he actually wrote, very poetic,
Lola poetic.
Excuses, excuses, excuses. kidnappings in Lagos. Oh no, it's because of the waterways that leads to Port Harcourt and Bayelsa. No, okay, sir. What of the ones that lead to Ekiti? Oh, forget that one. It's because of the forest in Ekiti. I am tired and I give up. Isn't that poetic?
And I think that's really the sentiment of a lot of Nigerians in this particular situation. But we know that the police public relations officer, Olumuyiwa Adejobi, had an interesting reply for him. So let's look at that reply, and then, of course, we'll go into that. Okay, he said, you don't need to give up. That is the reality. Most of the kidnapping cases we read online are not real. They're either staged or fake. We analyze security situations based on empirical facts and figures. We will have another forum or many other organized fora to discuss these concepts of kidnapping, abduction, one chance, armed robbery, organized crimes, and arranged assassination. These are different concepts or crimes that we need to understand in the psychology of the perpetrators. No sentiment, but reality. Open your mind to discussion and explanations of experts and security operatives for a better understanding.
Honestly, Tolu, I find this very offensive.
Tone deaf.
No, this is really, it's tone deaf. He didn't even address the issues. He just gave like a clinical answer. So are we saying that, even insinuating, which of these have turned out to be fake?
So let me give you an example. So this past weekend, my husband showed me a video of, I don't know if he's a content creator or whatever he is. I was looking for the video to share. I watched it, so it's not a they said. He was in the forest, he was panting, pretending like he had gotten kidnapped, that he wanted to just see how it felt. He posted it on his page, and before he could blink, bloggers had carried the video that, oh my God, this is yet another kidnapping case. So the guy had to come in and say, no, I was just trying to create content. Let's also not forget university students who have staged their kidnappings. Boyfriend and girlfriend that have staged kidnappings.
But those things have not happened in recent times.
At this point, it becomes very difficult for the police to tell what's real and what's not. But not this Ekiti one. I'm not talking about that.
In fact, for me, even saying that, even if there's so many things that the police do that I find a bit confusing, there's some things that you wouldn't even say. Even
I think in this case, I really
because
don't think
the people of the country, look at the Ekiti people, they are in pain. All those who are the Nabiya family, they are in pain. And now making this kind of, suggestion that some of them are faked and staged. No, but it can actually mean offensive or insensitive.
Hold on. Okay, I said something and said, this is what she saw happen over the weekend. Someone said, oh, let me see how people will react to it, and how it feels. And you see, everybody just jumped on that and it went viral. What I think, for me, the first thing I would say to this policeman's tweet would be that he's glossing over. First of all, you want to save your office and make it look like you guys are doing the work that we task you to do as Nigerians. I feel he's glossing over the issue. And I feel at the same time, being a smart mouth is almost for him, is a way of saying that X users, because everybody knows, you have to be on X. Not everybody is on X. If you are on X, it means you have to have sense. So it's just like a sense.
Okay.
Sense. So I
needed to lighten this up, Kathleen.
I think for him, he's glossing things over because that's what we do as Nigerians, Lolo. We said it now, we've glossed over it. Yeah. We have moved on and sit down in our little corners and pray that this doesn't happen to us, to our loved ones.
Anyway, I would say that there will be no national security eventually without a nation to secure. Because if everybody has been kidnapped or everybody is going through some very dire situations, I wonder if the police the PRO would just say this. I think it's a bit insensitive. Sometimes we need to tone down and feel the pulse of the nation before we say something, so that people don't feel bad. I wonder if I'm from the Ekiti and I read this, I would literally cry. That they saying that this thing could have been, it's not just appropriate at this time.
So that's I just think across governments, across institutions, and particularly even security agencies, a lot of them are quite tone deaf to what the reality is. They're always just finding a way to sort of patch things up and make it seem like it's not as much as it was or it's less than it was. But that's not the reality of Nigerians.
If you ask me, honestly, no holds barred, carte blanche, if you ask me, I think the government doesn't think it is serious enough for them to pay attention.
Or that
Je te
they
jure.
owe Nigerians enough,
Yeah.
the type of explanations that Nigerians are demanding.
Yeah.
Because we're asking questions that in many, many instances, government is unable to answer for us. Out of 5 kidnappings, a lot of the times you see that it's maybe 1 or 2 that you're able to really actually get abducted. The other 3 go free. They either go free after killing people or taking away millions in naira of ransom.
All the things that we put that are laid down as procedures, every one of them have been flouted.
Yeah.
Before, I thought we had the same policy with Americans that we don't negotiate
with terrorists.
But we have seen negotiations happen. Even within government people, they have paid ransom. So sometimes they really don't have any answer for us because even they themselves, they probably are confused and they don't know what's really going on.
They'll never admit it.
So, but they won't
Ladies,
admit it.
before we move on, we should have really just started with the weekend. Let's lighten things up before we get into our conversation.
Yeah.
Catherine, how was your weekend?
Actually, man, don't ask. I was.
I take it back.
Tolu just no, really, no. It was okay. I went to Ibadan. It was okay.
Ibadan.
But you never told me what you went to do.
It's
You know, you're always closed-mouthed about this.
It's coded.
No, really.
I suspect you.
It has nothing to do with it. It's just tidying up family things. That's
Wow,
all.
I like Ibadan visits.
Lolo, how was your
my
weekend?
weekend was fabulous. I had 2 parties on Friday.
Yes, she was just
Saturday.
jolly. Me.
And I was so happy because one was at Lagos Country Club, another one was at VI here in Olu. And I was so happy that both dress codes were same, white and gold.
Wow.
So I just donned on one dress and I went for the one on the mainland and ended up on the one on the island.
Do you really? Let me ask you. Do you really enjoy these parties, or you go there because you are working
I
there?
enjoy the parties.
You, I know you enjoy the parties.
I enjoy the parties.
But you all know that Owambes are not my thing. I would only go to parties.
No, we
because
don't all know that, huh?
No, you just think I go out a lot. Toli's husband seems to have that thing that
you're
I'm
always so
out.
happy. Yeah.
You see, this year, I actually told myself that I would go out a little more. Last year, I was a bit
reclusive.
Yeah. Honestly, I was, and it was affecting my mental health. I was in those kind of spaces of adequate, inadequate, but now the butterfly has come out. Even Valentine, I had no plans. Who knows?
All right, so we're going for a quick timeout. So when we come back, the World Health Organization has released shocking statistics on the growing global burden of cancer as the world observed World Cancer Day on February the 4th. After the break, we spotlight the race to close the cancer care gap in the fight against the rising cases of cancer amid inadequate services. Stay with us. All right, so welcome back to Jasiri. Remember, we're streaming live on social media across all our platforms. So if you're on the move and you can't watch us on DSTV, channel 422, StarTimes, channel 274, you can still be part of the conversation on X, Facebook, and Instagram. Just make sure to use the hashtag Jasiri so we know you're watching and you're listening. Now, this morning, we're shining a spotlight on the alarming increase in cancer cases, like Tolu said, and the need to close the gap in critical cancer care and services. Now, according to the WHO, the number of new cancer cases globally will reach 35 million by 2050. That is 77% higher than the figure in 2022. In case you think that this is outrageous, let's bring it home. We're gathered during our research that one teaching hospital that has 2 clinic days in a week may see an average of 15 new cases per clinic day. That's 30 new cases a week, 120 new cases a month, and 1,440 new cases a year. But the catch? That's just one hospital. These numbers are not just statistics. They represent individuals, families, and communities that are grappling with the profound impact of the disease, in some cases, which can be preventable, and in many cases, treatable if caught early.
And joining the conversation now is a medical doctor and the founder of Marcelle Ruth Cancer Center and Specialist Hospital. Please help us welcome Dr. Modupe Elebute-Odunsi. You're very much welcome to the show, ma'am.
Thank you so much for joining us, doctor. I think you might be muted. Can you please quickly check your microphone?
I'm not muted.
Okay, there you go. Okay, it was from our end. Apologies. Thank you so much. Let's get straight into the conversation. In terms of, particularly for me, the cancer research landscape and treatments that has evolved over the years, particularly here in Nigeria, have we been able to see breakthroughs? Have we been able to see progress being made in whether it's catching cases early, treating them, or in any form increasing people's opportunity to live beyond a cancer diagnosis?
Well, thank you very much for having me, as I said. And I think that actually you had outlined it in the statistics that you gave earlier on, and in particular bringing it home about how there are 15 new patients per week or 30 per week in teaching hospitals. I mean, I think obviously worldwide there's been a lot of work in cancer research that has changed the landscape of how we manage cancer patients, that's for sure. And in particular, not just in terms of new diagnostics, there are new surgical techniques, for example, robotic surgery and things like prostate cancer, which reduces the sort of long-term effects and makes the surgery more successful. The biggest issues have been actually, or movements have been in the pharmaceutical industry, developing new drugs, targeted therapies, which are not just like the old style domestos chemotherapy that killed all cells, including hopefully the cancer cells, but are targeted in particular to the cancer cells that we're trying to get rid of. So in breast cancer, there's a drug called Herceptin that's been developed against a particular receptor. So there's a lot going on. I think what you've already alluded to in your outline is that in Nigeria, we're still grappling with the basis of detection and treatment. And what I mean with that is that particularly with detection, because honestly, if we're going to put your money anywhere and your hope anywhere, it would be in trying to detect things early or even to prevent cancers in the first place. We all know what the risks are of getting cancer, although when I give talks and when I talk to my family and friends, I always say the biggest risk actually is age. So the older you get, there is a greater risk of you getting cancer. And of course, there are all the other risks, smoking, excess alcohol, the weight, particularly your waist ratio, which is a risk for diabetes, hypertension, and cancer, and so on. But I think where we really need to do the work, which is where the world has gone, is trying to ensure that in the primary healthcare services that we develop, we put in place really secure processes, awareness, education and awareness for everybody. And in particularly when you get to the age of 40, when you should start having your annual wellness check, we should almost make it mandatory. In the UK, where I spent most of my career, came back to Nigeria 4 years ago to start up Marcelle Ruth. Once you reach 840, you get a letter, and then after that, you'll get WhatsApp messages saying, have you had your pap smear? Have you had your mammogram? Have you had your colonoscopy?
Yeah,
so,
Dr. Ruth.
And that's where we really need to go in Nigeria. We're a long way from there. And of course, we really need it because the access to treatment is not great.
All right, Dr. Ruth, in Africa, you've talked about the UK and the things that they do, but it's a bit different in Nigeria and I would say Africa as a whole. We are still grappling with things like misconceptions about cancer. Of course, there's still many deep-rooted myths that a lot of people propagate, and there's a need to address some of these misconceptions and the adoption of preventive measures. We are still grappling with those kinds of things. What can we do to better educate ourselves when it comes to cancer and the misconceptions that are wrapped around it, especially on prevention or even diagnosis?
No, first of all, my name is Dr. Elebute-Odunsi. Marcelle Ruth was my mother-in-law who died of complications of breast cancer. But I totally agree with what you're saying. And also, it's not even just the misconceptions in terms of when people find a lump, for example, or find something that's not right. We, on the other side, on the clinical side, it's a huge issue that you raise. And when we see the patients and we make the diagnosis in a we get people then disappearing. They go to church, they go to their herbalist, they could go to other people who give them all sorts of advice. We're very good in Nigeria at comparing what somebody else is doing or wearing the same. I heard the comment about the Ashoebi, right? Or somebody giving you a color code to wear to their party. But that is us. We do what everybody else tells us that they're doing. We don't, and even when it comes to taking advice from the doctor, what we find is we sit them down, we make the diagnosis, we put in place treatments, and patients could disappear for 3-4 months. And when they come back, they've been on the hallelujah diet, they've been praying. And what I always say to them is the same God that is looking after us, that it's also developed the doctors and the medicines, do everything in parallel. So don't just walk away and not have the treatments and come back, because then it's too late. Then the cancer has spread. So you're absolutely right. It's a huge issue for us. The cultural, the religious issues, the alternative access to medicine. But sometimes you can't blame the patients, let's be honest, because the access to the proper treatment is not easily done. And it can be very, very expensive.
Yeah.
So that's why sometimes people go the other routes, because they really can't afford the care. Recently I had a 6-year-old girl brought to us from the teaching hospital for radiotherapy, because we're one of 10 centers in the country that has radiotherapy, which is an important part of treatment. So that's how limited access to care is. This young girl's mother was a kunu seller, apparently that means tiger nuts, and the father was a carpenter. Where are they supposed to find the money for the treatments that this child needed? So there are multiple issues, but we also need to, I want to make the message clear.
Okay.
Most people make sure that they have their annual checks done. If the people are aware that, look, I need to examine my breast, let's take it down to the basics. I need to examine my breast monthly around the time of my period. If I find anything at all that's abnormal, I need to seek medical care and I need to stick with it. And for those who I need to have my breast ultrasound scan done. I need to do my mammos from when I'm 40. For the men, I need to have a prostate antigen PSA test done. And for everybody above 50, I need to have a colonoscopy. People are so very like, oh my gosh, colonoscopy. I mean, we all go to the bathroom, right? It's human nature. This is a test that can really prevent you from getting colon cancer, which is not a very nice thing to have, and which could take quite a long time to treat. So yes, I'm so glad that you brought this up on your program this morning, because we have to all pull together. We do a lot in terms of education and awareness, and so are a lot of other hospitals and NGOs. This February, we're flooded with it, and I'm very, very thankful.
Okay,
this is the only way
Dr. Elebute-Odunsi, you've spoken a lot and given us a lot of information to chew on, actually. And I know that some people are not aware of how damaging these can be, and then the treatment and the cost of it. I don't even want to go into it. I'm interested in the alarming statistics that Nigeria as a country has witnessed, especially with the exit of multinational pharmaceutical companies, which no doubt must be affecting cancer patients. Now, I'd like to know, have cancer patients really been impacted by these exits?
Well, I think the exits are quite recent, to be fair. I don't know that. I mean, for example, in our practice, one thing we need to understand is that a lot of the consumables and the drugs that we use in Nigeria are still imported. So, although, I mean, a lot of the drugs that the pharmaceutical companies that you're talking about are exiting, there are more sort of drugs to do with paracetamol being manufactured locally and so on and so forth. In Nigeria, you can get the drugs that you need for almost anything. The problem is that most of the time we have to bring them in or buy them of people who bring them in, and that takes the costs up. So if I'm going to answer your question, it's the other way around. The government needs to encourage even local pharmaceutical manufacturers, and there are some, and to support them to help us be able to make some of these drugs locally, just like almost so many other things that we need, so that we can make them locally and the costs can be reduced. But I hear what you're saying. We have a massive problem in terms of how patients can access care for cancer and even for other conditions. And this is something that really the government needs to pay attention to. And I believe that the current new ministers of health, we've got two for the first time, the coordinating minister and the Minister of State, because that's how important the government realizes this problem is. And I'm hoping that working together across private and public sector, we'll be able to begin to make an indent in the issues that we have in the healthcare system for cancer patients and others.
Okay, so coming back to the report from the WHO and, of course, the rising cases of cancer, it also shows that changes to people's exposure to risk factors are associated with socioeconomic development. So I really need you to break this down for us, because what we saw with that is that countries that have high Human Development Index, or HDI, are at lower risk of being diagnosed with cancers, while countries with a low HDI, Human Development Index, have this higher risk. And a lot of these countries are in sub-Saharan Africa. So when we're looking at this situation, how does that really impact the fact that, unfortunately, people might be born poor, be living in poverty, be struggling? How do those things sort of impact on the rising cases of cancer?
Well, I think, as you know, it is in terms of, for example, pollution, okay? Generators, we all live and breathe them. We all think it's normal. Because we're collecting data. We've seen over 4,000 patients. About 70% of what we do is cancer care. So we've seen over 3,000 patients at Marcelle, Ruth, one center in Victoria Island of cancer cases, but we're seeing patients from all over the country coming to us. Now, one of the interesting things, for example, is I think we have something like about 8 young women who have lung cancer, women who don't smoke, women who don't live with people who smoke. So other environmental risks that we're exposed to on a day-to-day basis. When we look at the cars that we drive on our road, most of the world has moved to absolute legislation about the kind of pollution that can come out of cars or lorries or vehicles. We don't have all that. So we're living with, there's problems with water, you know, the water systems, there's no regulation, and so on. So there's so many factors there. There's some information about nutrition and maybe some of the foods that we eat before they're packaged. They're not packaged that well. They're not dry that well. They may have mold in them that have things like toxins. So there are a variety of issues. But again, like I said, we have to start with primary health education, awareness, the steps that are known internationally in terms of doing assessments and to ensure that if you have any problems, you're picked up early. Because that phrase, early detection saves lives, is absolutely true, okay? Yes, when people then have it, of course, there are a number of ways to treat, including surgery, chemotherapy, radiotherapy. One thing I will say is that once it's picked up, the treatment itself for most cancer cases goes on for 6 or 9 months, or it's not a question of just going to hospital 2 or 3 visits. It's a long-term problem. And you referred to it already about the impact that it has, not just on the patient, but their families. And one of the reasons why I've come back, and a number of other people, to set up places like Marcelle, Ruth, is that we're reversing this medical tourism business where our own patients would be diagnosed and then have to go abroad to India, to South Africa, to the UK, to the US. They have to go for almost a year. Cancer treatments are not over a few weeks. It's for months.
Doctor, you know,
away from their family, from their jobs, from their their comfort zone, from their ability to mix up with their friends at the weekends that you were talking to earlier on. So that's why we're proud to be back, because now we're able to look after patients and they can go home.
Doctor, you know, I was very happy when you mentioned the fact that you want to reverse the medical tourism experience that is our own case in Nigeria. That is on one side. One of the biggest challenge that we have is that we have more vulnerable groups. And you know that there is a huge gap there. And some communities actually suffer the most. You know, maybe I will just push that into the fact that there is a rising case, there are rising cases of, you know, some certain cancers that are more prevalent in Nigeria. And I don't know if some of these are, you know, region-specific challenges, and we need, you know, maybe specially tailored, solutions or attention, how can we put more emphasis or help for those that are in the vulnerable groups?
Well, I think, we can do what we can in the private sector. The public sector is where the majority of patients can access. And I know the government is trying to do a lot of work in terms of putting together this new health insurance scheme that would be open to everybody. But, we as a country, to be honest, we need to start back from the primary healthcare, because that's where people should be able to just walk in. Anybody should be able to walk in and access care, right? Mm-hmm. That's part of the problem. And that's how it works everywhere in the world. But again, whether we like it or not, we've also got to understand that we have an issue in terms of the infrastructure that's needed, both in the public and the private sector. We have an issue with staffing. I hate that word, Japa, but whatever you want to call it. All our very talented people. Let me just tell you something that happened to me at the weekend. I had to travel because my son turned 21 and is in university in the UK, so I decided to come across. I met this young lady in the airport, and clearly she hadn't traveled before, and she was asking me where she should go and what she should do. So I started off a conversation with her. She's a pharmacist who had been offered a job applying online by a big pharmaceutical company in the UK. They bought her a business class seat. They were going to meet her at the airport. They had organized her visa. They had organized the visas for her husband and her daughter to follow her the following week.
Wow.
This is how other people are treating with value staff and people that we have trained, that went to pharmacy school, medical school, whatever, where the countries train them. We've spent that money, and it's extremely expensive to be trained as a pharmacist or as a doctor in the UK or in the US, right? And then next thing but they're treating. This girl, she felt she was like a queen, to come and get this job. And I did, goodness knows what salary they were. So the whole story needs to change, but it needs to change from the bottom up and the top down too. Okay. We have to improve our access to care for, as you say, not just for everybody, in terms of ensuring that there is education, there is awareness. People know where to go if they have a problem. And when they get there, that there are people there to look after them who are skilled.
Qualified.
We're losing all our skilled workers. It's going to be a massive issue to replace these young doctors who are leaving. It takes almost 10 years to train as a doctor, and then even you want to specialize, even more than that. So yeah, a lot of work needs to be done. I have to say that I don't know how to say, but I'm hoping and praying that with the new political will to, at least in healthcare, that we've seen, and we've seen it. Last week we launched something called the Women in Healthcare Initiative, which is bringing women in healthcare across both public and private sector for the first time, across all specialties, to work together. It's been amazing. And the coordinating minister of health actually came in person, Professor Mohammed Pate. So I think there's evidence that there is a will to try and change these things. But one of the things, our biggest issues in Nigeria, we're 200 million people. That's the first thing. And also, where things have gone so, I don't want to say bad, but it's been, that the change is going to be such a tricky thing to do. I mean, for example, with us, like I said, we've seen almost 4,000 patients in 3 years. I can't believe it. I mean, it's unbelievable. And these patients are coming from, they just turn up from Zamfara, from this, from Yola. Sometimes they don't even call, they don't make appointments, they just hear about us and they turn up. But we're also seeing patients now coming to us from Liberia, from Cameroon. There's so much need, right, for all groups. And people say, oh, well, you're only treating the top 1%, but that's not true. One of the things I've realized in Nigeria, and I'm very proud of us, is there's a social insurance system, social support network. So we see patients who would not ordinarily be able to afford treatment.
Yeah.
Because they have relatives who are abroad, those people will pay for their care. And we're very good at that.
Okay.
But there's so much more that needs to be done. There's no doubt about it. But working together, public and private partnerships, hopefully we'll get there.
All right, Dr. Modupe Elebute-Odunsi, founder, Marcelle, Ruth Cancer Center and Specialist Hospital. Thank you so much for joining us on this conversation. And it's one that we'll continue to highlight because while there are genetic and hereditary predispositions, there are also lifestyle changes that we can all make to reduce the potential for us to have any of these issues. Thank you so much for joining us.
Thank you.
I encourage everybody to have their annual wellness check.
We will do that.
Prevention is better than cure.
Definitely.
Thank you so much for having me.
Thank you so much. Thank you.
Very enlightening conversation we had with Dr. Elebute-Odunsi.
It gives me goosebumps because I lost a sister last year to cancer. And I saw
firsthand.
Yeah,
I saw firsthand.
Yes, it's a humbling.
It's a humbling
experience.
My mom,
and
it's nothing you wish on your worst enemies.
Yeah.
Trust me. But just as she said,
from the 100, the way it goes from that 100
0 to 100.
0.
Oh my God.
100 to see someone in top form from 100 to 0.
Unbelievable.
And I think in terms of the myths and misconceptions, we need to address that as a country because it does stop people from really seeking treatment. There's faith involved, there's prayer, but there's work, and the work is for the medical people. And then also get tested. Get tested. If you have a first family member who has had any form of cancer, your likelihood of having cancer increases. So
by pretending that it won't happen to you, by wishing it away, doesn't change anything. This is science. You have to take the long road. You have to put in the work. You have to do some lifestyle changes, whether we like it or not. You have to stay away from some things that are bad for you. I can say this because coming from a medical background, you see these things happen every day. Guys, it is real. If you don't, like the doctor said, if you don't take charge of it when you're young, don't even wait till you're 40. When you start living an intentional lifestyle from when you're young, it follows you as you grow older.
Well, people will tell you that there are people who have drank and smoked all their life, they don't have cancer, and there's somebody who hits the gym every day, goes to sleep at 8 o'clock and gets diagnosed. Life is not fair.
Life is not fair.
All hands are not equal.
It's unpredictable.
It is.
Very heavy conversations we've had this morning. We will take a break. When we return, it will be time to, for us to have lighter topics and, maybe douse the emotional tension in the studio.
But before then, how proud are we of the Super Eagles?
Oh my God!
On a lighter note.
On a lighter note.
On a lighter note.
Everybody saying that, Kevin Pepe.
Welcome back to Jasiri. Don't forget that we're streaming live on our social media platform. So you can, of course, watch us on DSTV channel 422, start times 274. You can also follow the conversations on social media at News Central TV and use the hashtag Jasiri. Let's get into hot topics because we know you've been waiting for it and I need something lighter after that conversation right now. So before we get into it, of course, Catherine has mentioned how proud we are of the Super Eagles. Whoop, whoop! They have now advanced to the semifinals and are facing South Africa next Wednesday. But I've been seeing some tweets now and people are saying, South Africa, please behave. This is a game. It's a match. Let's keep the banter friendly. We don't want to see anything descend into xenophobic attacks if Nigeria should win.
Yes.
And I think I sort of understand that sentiment very quickly.
Honestly, I agree with them because things escalate so fast when it comes to South Africans.
And Nigeria.
And
that
Nigeria,
conversation.
The only thing that unified us was what happened recently.
Just play the
game.
freaking game.
Let's move on.
And let's go to our first hot topic, please.
Let's go to our first hot topic story for today. I'm not even sure if it's a case of woman empowering woman or Atusabi. Still, here's this gist. There's this lady, she asked her cleaner to fix her ATM issues so that she can stop paying her wages into her husband's account and give the cleaner more control over her money. Now, as a result, the man has asked the wife to quit her job because she said, please show me how to do things so I can organize my money. Please, the floor is yours.
Honestly,
What say you?
in this one, you say that she should have minded her business, but I think she just gave a very good advice, really, because she's the one working. So why should she not have access to her own money and her own account?
But
I blame it on low income earning family.
But do we know the agreement that husband and wife had?
What kind of agreement?
There's no agreement, Tolu.
No, two become one. Is that not the
No,
agreement?
Tolu.
Someone said that this lady on Twitter, Sholakpe, her name is Sholakpe, is that she's the one that was created to put asunder.
No. The thing is, they can actually have their
one
account.
at a time.
They can have both their accounts and have maybe a common account.
Oga does not want both accounts. Are you not hearing this thing?
No, why won't Oga enjoy
No,
it?
so why-
Because all her salaries are being paid into his account. He's the one in charge of all their money.
Well, I know that you
so
can
why
be
is he
sweet
raining a ruckus
sometimes,
when
but-
they said she should start to, man her own money?
No, you're
Something
not,
she's
you're
got
not
to
hear what
hearing
Catherine has
me.
to say.
You know they hear me. Are we now tone deafing? You know they hear me. What I'm saying is that Oga does not want that. Tolu has mentioned there's a 5 and 6-ish.
I said it's a 1 plus 1 equals 1.
1 plus 1 is 1. No, that's not what our brother has in mind. Because if that's what he has in mind, it should be easy. It shouldn't even be it should be a non. Oh, my father calls it one. It's a non-event.
But somebody said that
it's a non-event.
at the end of the day, it shouldn't be that if the man meant well for his wife, he wouldn't be worried about where the money was being paid into.
And then you say she should leave her job.
And do you
I
know
don't
how
understand.
uncomfortable it is sometimes when you are paying somebody's salary into somebody else's account?
No,
it just
it's a
makes you
form
feel like the person has no control. She's the one working.
It's a form of
and
control.
sometimes there is
Financial abuse.
Do you know there's a lot of satisfaction that comes from seeing what you earn? You can look at it. It just gives you a kind of satisfaction.
Let's see if we can get some of the reactions to this tweet, because there were a lot. There were accusations that the man is financially abusing her. Food blogger CCME said, I had a staff that did not know how much I paid because she had no access to her account. Some days I paid her bonuses. She had no clue. I was always surprised when she would ask me for money to buy things like sanitary towel only days after I paid her.
Exactly.
No access to her account. What's another reaction to this? A lot of people did have personal views to share on this. Someone said you have subtly and successfully sacked her because you don't know the agreement she had with her husband as per their finances. Y'all should let couples live their lives however suits them and apply whatever strategy that works for them.
Even when the woman seems like she's blind and in bondage.
Let me read this one. One sales girl gave me her man's account, and for 3 months he insisted payments were not made while refusing to provide his bank statement. I told her that if she couldn't bring her own account, she could leave. After that fiasco, I don't employ women who don't have their own account.
My dear, don't call me cheat.
I like
I don't blame you.
like
I
that
don't want
You made a comment and you're saying this is about low income, poverty, or women at a certain socioeconomic.
Yes.
But financial abuse happens to even women in rich and what do you call it, middle class and higher middle class.
Honestly, it's more prevalent where there are low income families because of education and understanding.
Lola.
Most middle class and high income earning women, they know better.
No.
But if
it's about financial education.
Wait, but if it was a husband who was working in a company,
Would
and
he let
I
them
will
pay
leave this
into his
place for
wife's
you.
account?
No.
there are men who do. There are men who say, I'm not good with money. Let my wife manage everything.
They are very rare.
In all honesty, it's bad because you are supposed to pay. The law is you're supposed to pay into the account of the person working.
Exactly.
But are you looking at it from your point of bias, from your own perspective?
I don't think it's bias. I just think it's good for everyone
All
to
right,
be able
let's
to
move to the
man
next
their own
story.
money.
Because
anyway,
we will not win. Lolo, this thing you're saying, Kole, makes sense to me.
it's okay.
I
I'm
love
going
it,
to have to
Yusuf.
succumb. I have to
doesn't.
succumb.
No, it
All
doesn't.
right.
All right, let's see what we have. What
Yeah,
else?
it's
Yeah.
time for yeah.
And the
Yeah.
winner is not Nigeria.
Yeah. Anyway,
I'm so
who
sad.
stayed up? Who amongst you stayed up to watch
me.
Burna Boy's performance at the Grammy? Anyway, despite the absence of Grammy wins for Nigerian artists, their nominations have showcased their global impact and recognition within the music industry and in the spirit of African unity. We should be proud of our girl Tyler. Yes, her song Water was a mega hit. I can attest to that. On top of that, she became Africa's youngest Grammy Award winner at only 22 years. Tolu, what was I doing?
No, don't ask me about what I was doing at 22.
Who now
she
said
made
that?
her
I'm so
confident
happy there's no
proud.
social media when I was at 22.
I'm so glad.
Listen.
Please, let's not divert to Grammys.
Yeah. I felt bad that we didn't take any of the nominations, but I feel happy because Nigeria, especially music, has put Nigeria and Africa on the map.
Well, I'm a bit biased when it comes to this because I think, no, our
You should
artists...
have given us.
No, our artists, because I think we are carried away a lot of times. It's just how we are. You know, it's the Nigerian in us. We're carried away by what we are and how we do our music. Sometimes we take it a little bit over the top. And when you do music, you are intentionally seeking out these audiences, these platforms, the Grammys and all that. But sometimes it's the little things that become the most important thing. Hold on. You are crazy about the song Water by Tyler.
What makes you... I said everybody accepted
But you said no. You say you like the song.
Yeah.
I like the song as well.
Make me cake.
So
water.
What's that?
So you have to look at what makes you like the song. What have you seen the video? What makes you... What do you...
No,
He's a catchy song. What makes you like Burna Boy and Asake and
was
Davido?
viral.
It's the same thing that makes you like them as well.
Burna had big songs. Davido had big songs. We had a lot of big songs last year.
And they expected to win. Tyler went in there. She didn't expect to win.
But it's okay.
Yeah.
We have won too. We won last year.
Yeah.
We had some winnings last year. So, but I'm just happy that Africa, Nigeria, we are being noticed.
Yeah.
And that's it.
But for me, I feel bad because this inaugural, a lot of people believe that it was the Nigerian music scene, the growth of Afro beats that really led to this African music performance category. I think I know I mixed up the words. And it didn't go to any of the people who are some of the biggest people, you know, really pushing that category and pushing that music right now.
I mean, as a performer, Burna Boy, you don't have anything on Burna as a performer. Yeah. You see Burna Boy perform, he does not rehearse and he just goes with the, in quote, spirit. He is a natural born performer. You can't take that away from him. I was just looking at his performance.
We love our artists.
I'm saying that.
I know.
But did you guys see the fact that when Tyler was coming on stage to come and collect her award, they now started playing Fela? I'm telling you, there's a Nigerian behind the scenes.
There has to be.
Honestly,
because
Lola
said something.
Somebody now said, at least, water is nobody's enemy.
Lola said something, that Nigerian music is on the map. It's been on the map. You can't take that away. Our artists not winning the Grammy doesn't take anything away from their music and from their craft. So, I mean,
South Africa
you live
will give
to fight another day.
But that game, we're taking it. And, you know, if we're doing that, let's make ourselves 1-1 this year, right? And at the end of the day, also, let's look at the requirements for the Grammys to win in certain categories. And we have a lot. I know some people are now talking about whether or not Tyler made it onto the Hot 100 charts. And there's still always this comparison onto the Billboard, onto the hot charts at the end of the day. But what really is the requirement to win the Grammy? We're talking about an academy that has to vote. I know sometimes, like with Burna's first award, there was conversation about a lot of campaigning that went on behind the scenes for him to get that award. So there are intricacies involved in winning Grammys that sometimes we don't see. And then somebody won a Grammy and was arrested. Like, let me tell you guys, you need to tune into E! Central tonight. No, it's not even tonight. E! Central at 4:30 p.m. West African time. The entertainment team is going to give you all the gist that happened at the Grammys. Who won, who didn't win, why somebody was arrested immediately after he won. Jay-Z had a few words for the Academy. Beyonce is the most awarded person in Grammy history, but she's never won Album of the Year. He had a few things to say on stage. So E! Central is definitely the place for you to be at 4:30 p.m. West African time.
Carry your flowers and go in peace.
Yes.
Do I give myself flowers or should my industry give me flowers?
Yeah, but even then,
everywhere, you should get your flowers
The
everywhere.
truth is, if we are going, anyway, Beyonce, it's a talk for another day.
Anyway, I wish we could take our last story, but maybe we'll push that to...
No, we have to push it.
Tomorrow. We'll do that tomorrow.
We must take that story.
But just before we wrap up, let me just give you a free public service announcement. Because, you know, plan your trips well. With these road closures and diversions on the 3rd Mainland Bridge, and now we have this Kodeso Bridge in Ikeja, there's likely to be heavy traffic in Lagos roads, at least, you know, in the coming days and months. So please do everything, plan around it. While you're out there, stay hydrated, be alert, and keep safe.
Lolo, this English you're speaking, in other words, we should be ready for traffic.
If you know how long it took me to get to work this morning, but we won't talk about that. Ladies and gentlemen, thank you so much for staying with us. We're just getting our week started, which means you can expect more conversations, being bold, big, and definitely conversations you will get into. And we want you to be part of all our conversations. Use the hashtag Jasiri. Make sure you join us on our social media platforms at News Central TV. We also want to say a very big thank you to our guests guest, Dr. Modupe Elebute-Odunsi, for joining us. And one thing she said, of course, make sure you're getting tested. As much as what you can prevent it, because prevention is better than cure. I said tour. Prevention is better than cure. I'm going. It's all right. On Monday.
You want to go on tour?
We'll take Jasiri on tour very soon. 10 a.m. West African time. See you guys.